wanted to take this moment now, folks. I'm honored and delighted to introduce our keynote speaker, Catherine Rosa, who comes to us from Boston, Massachusetts. You will see in the detailed conference bio that Catherine is working at Mass General Hospital in 2 roles, and she is also an instructor at the Department of Psychiatry at Harvard Medical School. Catherine is a qualified TT teacher and has attended the advanced TT workshops for many years since the 1990s. She credits listening to a panel presentation at Pumpkin Hollow as the aha moment that she knew she would earn a PhD and join the nurses who further the knowledge of TT. The inspiration for Catherine's presentation today, TT, Compassion in Action, came out of her nurse practitioner position at the Benson Henry Institute for Mind-Body Medicine, where she is the co-director of stress management. Catherine has had a long-time interest in neurology and consciousness, stemming from her early nursing days and nights, working at the neuromedical and neurosurgical departments. Then as a nurse practitioner, she explored the literature on the neuro changes being discovered in the practice of compassion meditation. She presented on therapeutic touch at the BHI conference, the annual Mind-Body Conference in 2019, putting together the neurobiology findings on compassion along with the TT process as a compassion-based healing strategy. A version of this work is published in the Journal of Holistic Nursing. In Catherine's words, she says, this presentation is her thank you to those who taught TT, Dee, Dora, and all the TT practitioners she's worked with. She is forever grateful. And we are grateful to have Catherine with us today. Join me in welcoming Catherine Rosa.
It's delightful to be here, and thank you so much, Sue, for that introduction. Okay, I'm seeing a lot of, there we go. As Sue mentioned, I'll be speaking about therapeutic touch, compassion, and action. And let's see. Oh, whoop, I'm going to go too fast. Hold on. It's a new way from my phone's giving me funny things. All right. So I'll be, these are the boring things. Anyways, defining compassion. I'll be, from the neurobiology perspective, differentiating empathy from compassion, describing the neuroscience, a little bit on compassion, and discussing the relationship between therapeutic touch and compassion, which many of you are very, very familiar with. Nelson Mandela has reportedly said, our human compassion binds us one to the other, not in pity or patronizingly, but as human beings who have learned to turn our common suffering into hope for the future. Compassion is not new. World religions have really been, for thousands of years, the owners per se, but the teachers of compassion, and that it is a virtue that has the potential to change the world for the better. This is cross religions. Western science more recently got into being interested in compassion, and that really started with the work of His Holiness the Dalai Lama, reaching out to scientists, one of whom was Richie Davidson, to have Western science investigate and hopefully collaborate and question what they had been discovering in their own studies on compassion in the Eastern traditions, and specifically in Buddhism. So Western science has defined it as it's a multidimensional process. It's rooted in our caring system. It's also influenced by cultural values. And we as humans know it by its qualities: patience, wisdom, kindness, perseverance, warmth, and love. Oh, I forgot to say this because I see a lot of pens moving. You're all going to get these slides. So after the conference, so sit back, relax on the nurse one, just enjoy. There's also all the information that's in this talk is published in the Journal of Holistic Nursing. It came out online in December. I don't yet know if it's in print, but I believe it is. I'm just not sure. Okay, let me get my phone going again. It has to look at me. There we go. Okay. So neuroscience defines compassion as a complex and distinct neural fingerprint. In nursing, and this comes particularly from the work of Dunn and Rivas, it's an essence of nursing care, a rich energy source for being with suffering persons over time, caring with dignity and loving kindness. In their work, they interviewed nurses, and nurses said, for them, the experience of compassion, it's different than caring. And they could articulate that. In therapeutic touch, our definition is, it's the consciousness of compassion that powers our ability to heal. Compassion is a process. First, we recognize that there's a suffering, and it begins with that perceiving a state of suffering through our empathic awareness. Empathy, in distinction to compassion. Empathy is our ability to understand and share the feelings of another, but it includes an ability to share the full range of feelings. We go with anger, disgust, to delight, joy, all of that we understand through empathy. Edith Stein, back in the early 1900s, and she has an interesting backstory, but she was studying with phenomenologists, and the phenomenon she wanted to study was empathy. The basic elements of empathy that she discovered have withstood, and it was, since it's phenomenological, that means it's a qualitative study. Reaching in, hearing people's stories, pulling out the information. These basic elements of empathy have withstood the tests of time. There's a non-judgmental awareness, openness, the ability to take multiple perspectives, an awareness of emotions. There's a hold to positive regard, and there's a validation. You communicate your understanding. All right, this is going to be, don't know, there we go. Sorry, I'm talking to myself. It's about my phone. What has been discovered through neuroscience, through neuroimaging studies, functional neuroimaging studies, MRIs, which have the ability to have people go into a scanner. These are sometimes skilled people. And the areas of the brain that are working kind of light up. And so they see that and they can add color to that. And those scientists can interpret that. So Klimecki and Singer did a meta-analysis, and what they were searching for was, is there a network that relates to empathy? And indeed, they found one. Just for anyone who's a neuroscientist, it activates the anterior insula and the medial anterior cingulate cortex. That area of the brain is what's helping us process and connect the physical sensations that we're experiencing when we experience an emotion. So if you become scared and you get that pit in your stomach, it's getting processed through that specific neural pathway, okay? It also involves the mirror neuron system and the limbic systems. So the mirror neuron system, these are, not only do humans have them, but chimpanzees and monkeys have mirror neurons. What they do is, so if we see something, it activates and we observe, and we lay down this pathway. So it helps us learn. And when we act it and experience it ourselves, those same neurons are firing. So if I'm sad, but I'm a small child and I've seen someone else sad and they tell me they've experienced that what their experience is sadness, and I am feeling that because we're all in a group of sadness for whatever moment, that's laying down. So that's my mirror neurons working. So when I see someone's face who has that expression, it gets passed through my mirror neurons. They get activated. I have my past experience. Oh, sadness, joy, happiness, whatever. The limbic system is also activated, and that's our system that's more connected with motivation, learning, emotion, and memory. So all this stuff is going on in less than the blinks of eyes. Okay, my phone has to look at me again in order to. I have to figure out how to keep this going. I'll tap it. Maybe that'll work. Okay, so when we perceive states of suffering, it can lead to human responses of personal distress, known as empathic distress. In the literature, it is confusing. It is also called compassion fatigue. And I'm here to tell you, neurobiologically, it is not. It is empathy fatigue. Compassion is a different beast. Beast might not be the best word. But from this moment forward, I ask you to be concise. It's empathy fatigue. It gives compassion a bad name, okay? But when we are in circumstances of overwhelm or feeling that we do not have sufficient resources, it can lead us to experiencing that distress. We could also experience anger, disgust, righteous satisfaction, indifference, or compassion. So, take a moment. How do you respond when you see some different suffering experience? How do you respond to yourself when you know you're in a suffering experience? Through the neural studies, the neural pathway studies, early studies have shown based on, okay, so there are folks out in that world, courtesy of His Holiness the Dalai Lama, who have had more than 10,000 hours of practice, specifically meditating using a loving kindness compassion meditation. They were voluntold to to participate because there was fear on their side for participating in imaging studies. Whoops, I went too fast. Anyways, I'll go back. Oh, no, I don't want to go there. I'm going with that. I'm working it. Thank you. All right. So what they discovered, because these folks have such skill sets that they can be put into an fMRI, those tubes, noisy machines, and be told, go into loving kindness meditation now, stop, now, stop. So this gives them the images. So what they discovered was they put some novice people in there. They'd only had 1 week of experience, and they compared the two brains, and they found that the experienced meditators had more activation in a specific pathway as compared to the novice. Okay, this is confusing, but what this shows is that there are these different pathways. So empathy is in blue, compassion is in red, right? So compassion training activates a network associated with positive mood, emotion, and regard, because they're linking this back to those structures, the limbic system, different systems, okay? Isn't it fun? Even more significantly, in my opinion, what was found was that compassion training reverses the negative feeling states activated by witnessing suffering. In this study, they took 25 women. It was control group. So there's a control group who was given a task on concentration. They then trained the women in empathy, scanned their brains while having them watch news footage of regular scenes, some suffering scenes on a variety scale. And then taught them compassion training and then scanned their brains again. What they discovered was that after they'd had the compassion training, while watching the news footage, different news footage, but similar, suffering experiences, that the women spontaneously activated their compassion system. And by doing that, reversed those states of disgust, anger, righteous indignation. They had calmed down their system, okay? Again, my phone. Here we go. I used Thupten Jinpa. He happened to be the Dalai Lama's translator for 20 years. He was a Buddhist monk, has subsequently, he's no longer a Buddhist monk. He's a dad with 2 kids. He also has a PhD. And he's one of the founders of the Compassion Institute out of Stanford. And his definition is, compassion is a sense of concern that arises when we are confronted with another's suffering and feel motivated to see that suffering relieved. In Western science loves to categorize things. So there's 4 components of compassion. A cognitive, so that's our thinking. This is when we recognize the suffering. Affective, that's our emotion. We're feeling moved by the suffering. Intentional, we're wishing relief from the suffering. And then this key piece of motivational, a readiness to act. Currently, it's not completely understood what sort of underlies all this. So there are some theories, but needless to say, one of the things that's been discovered is that when our compassionate biological response is activated, it activates our parasympathetic nervous system, which is also known as the rest and digest system. So our heart rate goes down, our respiratory rate goes down. Stomach settles. That was key for me because my stomach used to really get upset all the time as a new nurse. But I didn't know this back then. So what's being outlined neurobiologically is that when we see distress, we go into actually a slight stress response, all right? Heart rate goes up, blood pressure goes up. We might even feel that sense of nausea, but it puts us in a sense of we're on alert because our stress response system, it's meant to be protective, letting us know that there's a danger. And a component of that is we narrow our focus literally with our eyes onto the danger to protect ourselves. So that's what happens when we see a suffering experience. Ooh, that's a danger. With compassion training, I don't know where I'm getting this other box, and if I did something, I apologize for that. With the compassion training, that overrides the stress response. We automatically activate the vagus nerve, heart rate goes down, respiratory rate goes down. We decrease our own feeling of personal distress, increases our caregiving motivation. Science backs this up in multiple studies. Compassion, specifically the loving kindness training in Buddhists, it's called metta. I am it. May I be safe? May I be well? All right, that's what they're using, okay? It increases a sense of well-being. Telomerase is an enzyme, which, if you don't know about it, it's a really fun one. It helps keep the protective end caps of our chromosomes, they're called telomeres, what I call puffy. Keeps them, they look like little Q-tips. So it keeps them within their height. And why that height is important, Height, is because in their normal height range, that's directly connected to the length of the life of the cell. We're made up of cells, okay? The scientists, Elizabeth Blackburn being one of them, they won the Nobel Prize for discovering this about the telomerase and the telomeres. There's a book if you want to get it, but whatever. So it helps keep it within a range. And personally, and this is an aside, when I go to nurse practitioner conferences, haggard, tired, come to healing, therapeutic touch conferences. Okay, first day, yes. Second day, we look vibrant. I believe our telomeres are nice and puffy. Okay. So the studies are suggesting that compassion response can be enhanced. We can learn this. Okay. And when Bobby put this up last night, I went, we stole the same slide. Just to restate, compassion moves us to wish for relief from suffering and mobilizes our energy to act. So that brings me to therapeutic touch. I'm preaching to the choir here. We know it's a modern healing modality derived from ancient healing practices, Dora and Dee, and that knowing of our innate compassionate ability to focus, to heal, and in conjunction with our focus, our ability to focus our mind. No wonder Dora said, meditate, meditate. I'm going to move more quickly through these slides because you all know this. Basic assumption, human energy fields, humans are open energy systems, constantly evolving and exchanging energy. Human energy fields express the dynamic, wholeness, and synergy. This is from Arthur Rogers. Cross-culturally, we're working with the universal energy field. It's called different things from different cultures, prana, chi. In the Western medicine, they're calling it the biofield. Yes, are there differences? When you get down to the details in these definitions, yes. Personally, I believe we're kind of talking about the same thing. It's that elephant and everybody's got their hand somewhere else. So the view is a little bit different. All reality consists of energy fields vibrating at different frequencies. In TT, we are responding to that call of compassion. That's the first thing. In our process, we maintain sustained centering. We stay in touch in that center with that call, which came from them, which lights up ours. So we are in that compassion matrix, I guess. I'm just making that word up right now. All right, I can't quite recall, except for when I used the slide set that I presented this with at our annual conference. So I had to give more details, some of which are flapping through my, not clearly coming into my brain. But I gave them the definition of therapeutic touch, but the key piece here is that, as I said earlier, we're responding to that call of compassion and we stay there through our centering, our sustained centering. Dee Krieger in Advanced 2008, I had the privilege of, that was one of the times, many times that I was there. And it was this talk that just has stayed percolating way in the back of my brain for since then. So, and what I did, just so you know, I had I believe it was the CD of that. So I transcribed it. So these are direct quotes. all right? D says compassion is what urges us on in the healing moment. This is 2008. Today, as never before in history, we are experiencing a revolution, an acceleration of conditions that throughout the world are pressing us towards pulling upon our own individual potentialities. That press is helping to actualize them, you see. And when you look across the world, it is heart-rending. We're just being pressed to actualize more now. And again, from that same talk, it's the use of intentionality, in quotes, it's pulling on the upper chakras. And now I'm paraphrasing. The use of higher chakras invites ISI. TT therapists are technicians of compassion. That rattled around in my brain for a long time. Compassion is an act of free will, a choice. Acts of compassion ignite feelings of love and joy. Continued practice sculpts our human energy field. You now know from neuroimaging studies, it's been sculpting our neurons in our brains, all right? It's happening on multiple levels. So in the path of compassion, and I believe many of you are familiar with the chakra system, Dee proposed during 2008, and some of this information also comes back from Dora, but she proposed that this pathway is the same pathway that mystics and saints trod. In this, we are developing and strengthening connections between our solar plexus, heart, brow chakra. So in that process, we're integrating our emotional knowings with our love and our will, our choices. In the heart, brow chakra, crown chakra, now we're synthesizing love with, again, will, with choice, altruism, motivations to act, commitments to choice. Now, that was very brief on what those chakra systems do. There's a lot more going on, much of which is over my head, and many of you may have more information than I do on that, but that's just brief to get us where we're going, or where I'm taking you. The path of compassion, again, this comes from the 2008 talk primarily, and also supported by work from Dora. It activates our individual potentialities. If we start low in the solar plexus, it is sometimes increasing even just our knowing of our emotional energies. There's that first step with it. The heart, our loving capacity. Throat, our will, our choices. Brow, our abilities to visualize, reflect, integrate ideas. And then our crown is our universal love connection. Okay, so what I also did is from the CD, I was able to, as the whole CD is, it was like about an hour talk. This is about 4 minutes in Dee's words that I'd like you all to hear.
On the contrary, compassion is concerned with this burst from the heart chakra to the crown chakra that I mentioned before. If I go on to tell you that the path, and I'm taking a tremendous leap here, but just if I leave you behind, let me know. The path from the heart chakra to the crown chakra is really the path of sainthood. Do you follow me on that? Okay. then you begin to see what it is that you're on. You see, I really want to bring these things out. We don't talk about them more often. And as I said before, I may be wrong. But I think it's important because what we're into is something very simple, very elegant, and very heavy. You see, it's really heavy stuff. But it's fun. It really is fun, you see. And so, okay. And then I just want to repeat, just to get us, to keep us aware of that, the heart chakra, so to speak, is the place where Izzy can most easily reach into our individual, of course, activities of daily living. That maybe is the better way to put it than what I said before. Okay. And the bottom line is this, because TT so much revolves around the heart chakra, contrary to other chakras, you see. It is that reason why not only is it safe, but also that you can get so deep, you see. That is the reason. It's not because Dora or I said so, or because you and I are good girls and boys. And Tom, where are you? I know we have at least one male. There we are. Okay, right. So that's the big aha, you see. And you don't have to believe me, but it turns out that this time, by some of the best minds, because of this push, this press that I pressed out before, is thought of as being a time of opportunity. And just to repeat what I did say before, it's an opportunity to trod this new path of spirituality. You see, we can trot this new path of spirituality because TT, in a very practical, very simple and direct way, allows us to shoot forward, you see, and make these kinds of things a realization of our own compassion. Okay, am I all right? That's a hard one. Thank you. Okay. The whooper, the great thing about the whole thing is that we get A for trying. That doing this whole thing, now understanding some of the magic, perhaps we could call it, that's going on in the background, this is also the reason why TT forces transformation. This is the reason when you come back at the end of the year, so much has accelerated for us.
Thank you, Dee. So, kind of heavy to say, here we go, path of sainthood. I was raised Catholic. That has a specific meaning for me, or did. So to be true to therapeutic touch, I mean, saints, arhats, yogis, those religious traditions have had characteristics that they have assigned to a human being that they considered saintly or extraordinary. But in the TT tradition, we're secular, we're everything. So there is a secular definition of sainthood. And it's in the, I think I got this from Oxford, but it's acting kindly, acting virtuously or ethically. The person has a connection to a spiritual or sense of sacredness in life. And then I want to introduce a new topic to it, which this comes from a nursing perspective, a nursing theoretical, holistic perspective called the unitary transformative perspective. And in this perspective, all that unitary transformative perspective means is that we are human energy, pan-dimensional human energy fields in a mutual exchange process with a pan-dimensional universal field. And this comes from Martha Rogers' work, and Barbie Dossi was talking about this perspective. And in this perspective, I argue, not in a fighting way, but in the scholarly way, sainthood is not hierarchical. It is a phase in our human change process. What gives me the nerve to say that is I happen to be a scholar of Margaret Newman, who developed a theory of health as expanding consciousness. She describes the phases that our human consciousness moves through in life, from birth through death. And without going into a lot of detail, I just want to focus in on the phase in which I believe when we move into some of these characteristics, this is maybe where we're going, into this phase of boundarylessness, discovering our infinite capacity to love. When folks are in this phase of their life, they act from a deeper love for self and others. They're self-reflective rather than self-absorbed, live connected to a sense of purpose. They're able to transcend old restrictive life patterns, experience a bond of humanity between self and other, feel a sense of oneness with nature. Other nursing scholars, other philosophers describe this phase as becoming aware of mystery, life essences, the life force, experience timelessness, existence beyond space-time, pandimensionality. Teilhard de Chardin, French philosopher, describes it as that awareness of pure infinite consciousness in everyday life. Just ask you to take a moment, reflect in, maybe it happened in the last 24 hours, maybe it happened 2 or 3 years ago. In your life, when did you have that experience when you touched in and it was timeless? It was more than you could even grapple with. Maybe there was joy and delight, beauty, that pure infinite consciousness touching in. We have been given the gift. We have probably each of us been living the life way of TT. When we practice therapeutic touch, it is a meditation. Renee Weber said that. There's a study in which Dee participated. Her brain waves went into a meditative state while practicing therapeutic touch. We sustain that meditation. So therapeutic touch, from my perspective, is a compassion meditation. Those studies that they did with the monks who practiced 10,000 hours of loving kindness meditation, get in line, boys. I mean that. Okay, so maybe I have 5,000 hours of therapy. I've never counted it up. We have the neurobiology information that's showing it makes a difference. Our neurons are changing. There's more information about that. We change the size of structures in our brain when we're doing all this stuff. It's amazing. So as we're living therapeutic touch as a life way, we're coming to, and Dee said this in 1987, deep understanding of our own energies that provide insights how we can help others. As a compassion lifeway, it is an evolving interior journey of well-becoming that outwardly manifests as an increasing capacity for caritas and healing transformations. That's my work. And that's in the Journal of Holistic Nursing. I think that's it. I wanted to make sure we brought the lady. Questions, comments, disagreements?
Catherine, that was wonderful.
Thank you.
And I was really interested in your difference in definition between empathy and compassion, which I never thought about very much. But it reminded me of what Dora used to say, if you were taking in some of the heavy stuff from the Healy, which I did a lot in my early days. I'd get a headache, I'd get short of breath, whatever. And so her idea was to click into compassion and send that out. And then you would not get that empathy fatigue, which leads to burnout.
Yes.
So that just rang a bell for me. Thank you for that connection.
Yeah. Each time I read the studies, part of my work at Benson Henry is I need to do a deeper dive into the research. And so when I was doing more of a deeper dive into the loving kindness research, because we teach loving kindness meditation, light bulbs just kept going off in my head. Just what you're talking about, Kate. It's one of those people that could walk into a room and get a stomach ache. And because of course that person was suffering. So to see the neurobiology scans, I just was like, whoa. And then I continued to have these knee-jerk reactions every time I read something that said compassion fatigue. No, it isn't. No, it isn't. Is compassion a bad name? Remember. Oh, I saw Vicky's hand first and then Cheryl. Sherry-Ann. And I hope somebody's watching the board.
So I was very interested in what our brain waves are doing during that, and if it isn't going into theta.
I didn't look so specifically at those studies, but they are changing.
So Catherine, when you talked earlier on about the women where they learned compassion and the difference in the brain, the neural pathways that were established, I was really curious about how long a period of time they took to study compassion, and before that second brainwave activity, and also a part of that, what was involved in that compassion training, if you have that information.
I don't have it right on top of my head, but I can get it for you, Sherry.
Okay.
It was kind of a short period of time because they can see these changes within a week.
Yeah, and that was the point that I wanted to get to, because if you think you were talking about us in therapeutic touch practice and how we use compassion. And so it would be interesting to see what our neural pathways would look like.
Of course, we can't do the before and after for some of the folks who've been doing it for a while.
Do you understand it? Kathy, I just reflecting on some experience I had recently in psychotherapy with internal family systems, and their understanding that empathy comes from a part of us, a caring part, and compassion comes from self, what we call Izzy. And that's not a part, it's the core self. So I don't know if that's a useful thought.
Interesting.
Say it again. You want to hear it again?
Oh. Let me say it again. Me? Yeah. The internal family systems, which is a psychotherapy approach, which has got a lot of lovely resonances with TT, they talk about us having a core or essential self. And my bells just rang. I thought that's what we call Izzy. And that then over life, we develop parts of us to help us manage life and deal with things, et cetera, et cetera. And from that, their understanding, empathy comes from a part of us. So we can have very caring parts and parts that, nurses have very caring parts, but it's a part, and the part can then feel distress. Whereas when we're in self or in Izzy, it's not a part, it's soul, it's core self. It's, if I can use the word, pure. And that in that state, we don't feel, it's exactly what Kathy's saying about you can't have compassion and distress from that perspective, but you can have empathy distress.
With no disregard to internal family systems and psychology, the view that they have learned and been taught is parts, and that parts add up and make a whole. From the perspective that I've been taught and that I experience, we are a whole. So when we respond empathically, it is our whole being that is responding. And it's really again, for me, hearing Dora and Dee talk was very life transformative, but that ability to have them articulate the inner self and what that was, and then hearing Deb, what was that, 2 or 3 days ago, the within center. I'm not sure if this is helpful, but so in a compassionate act within the within, we are connecting, remember, heart, brow, chakra. So we are connecting with the pan-dimensional universal force. And that's coming in through the heart into our whole, where we have seen something suffering, and maybe I don't feel in the moment like I can do something. So now the whole of me is empathically responding. Maybe I'm getting the stomach ache and what can I do? So that is happening to the whole of me. And then I'm taking my deep breath and I'm centering. So I'm going maybe to the center, maybe I'm going to the center, within the center, wherever. And now there's that settling down, and physiologically, that parasympathetic nervous system has been activated. My heart rate's going down, my stomach's settling. I'm regaining more of a perceptual ability, gaining connections again with my prefrontal cortex. All that's going on. And within the whole of me, now I'm looking at the situation with a wider perspective and knowing that I want to act. And now maybe I just reach out, touch someone's hand. I've settled, maybe that'll settle them. So it's 2 different perspectives. Some would argue, that's not right or wrong. It's how they're seeing the elephant. But I see the elephant from over here. So it's not apart from my perspective. But I respect that from their perspective it is. I don't want to lose our Zoom. Is there any hands going up there? Okay.
Oh.
Thank you. And then we'll go over here.
Thank you. Can you hear me okay?
Yes, thank you.
Yeah. Thank you so much, Catherine. I'm a retired critical care nurse now, a few years ago, but after almost a 45-year career in a very busy 32-bed critical care unit, I retired from full-time in critical care, and I often wondered why I didn't burn out. I started doing TT in 95, 96, and I was always a good critical care nurse before that. But I think this explains why I didn't burn out. And I without knowing it, I used to think I had a switch that I could turn off when I would go out of the room to the break room. And anybody who's a nurse knows what nursing break rooms are like. But this explains it neurologically in a perfect way. And it's just so wonderful to almost validate the fact that I wasn't nuts and I wasn't off on a different planet, but I can on many, many, many occasions when I would be in a very bad situation, I would intentionally ground and center myself. And it made all the difference to horrific situations within the critical care world. So thank you for that. That was just perfect.
Well, thank you, Maureen, and thank you for staying in critical care for all those years.
Yeah,
I mean, what more does a patient need than an experienced nurse?
Well, I agree.
thank you.
And I've often said that the beauty of critical care is that you get a very rapid return on your energy investment when you do it, one way or the other, either helping that patient into a transition and helping the family accept that, or to slowly have the patient move on to healing. But no, yeah. So thank you very much. That's wonderful.
Thank you.
Thank you.
And then
Thank
over
you
there.
so much, Catherine. My question is about, were all the scans done with mindful self-compassion training? Or, do you have any insight into whether any compassion training would give the same result?
I'd have to go back and look specifically on Klimecki and Singer's meta-analysis. They looked over, I believe it was 45 studies. And
Okay.
at that time, they were working within a small range of a protocol, the kind of,
Yeah.
but I'd have to look.
Okay, thanks.
Thanks. Way in the back.
Hi. Thanks for bringing that together for us. Really appreciate it. I have some questions,
Sure.
which is a surprise. Do you think, I'm going to put them all together
Okay.
so you can process. First of all, can we teach compassion? Number two, is it necessary for people to have that compassion to practice therapeutic touch? And given the neural connections that you alluded to, you didn't mention the neurotransmitters, but in terms of, that's going on. In terms of the connections, what happens if someone's taking a psychotropic drug and we do therapeutic touch? What happens to that linkage?
Okay. First, I do not have experience either personally or professionally with psychotropic drugs, so I'm not going to answer that component because I just can't. The studies show, and the thousands of years of traditions in spiritual, religious traditions show that yes, you can teach this. You can teach compassion. It is considered, though, an innate human ability. And personal belief is that we probably have varying skill sets with that when we're born. And then depending upon environments, you might have been pressed from your environment to move into a compassionate space early, or maybe you were taught it, but at least in the science trainings, they are using loving kindness meditations. May I be happy, may I be peace, may everybody, So yes, we can increase our abilities. And although this is not tested, but personal experience and having, grown up with all you folks. I started therapeutic touch in my mid-20s. So yes, we've all seen kinder. And another definition is that and this comes from Marianne Hanley and Deb Shields and you, so I'm giving you your words back. We're kinder, steadier. We're able to be with more and stay with it. Did I get that right, Denise? And then
Obviously, I only ask questions that I know the answers to.
Yeah, but you know the psychedelics.
So, but that helped to pull the whole thing together in terms of, that's what we need to do to establish this base when we're doing TT.
Yeah.
And it doesn't really matter. It matters what the neural connections are. It doesn't matter that we know about them. And you answering, well, I don't know what the drugs do. Okay, doesn't matter. It's the compassion that we're talking about. Right. And that the person that's doing therapeutic touch has to have compassion as a base and then move. So thank you.
Go, Evie.
Okay, Catherine, I love you, and that was wonderful. Thank you. Mwah. But here, I'm trying to articulate something, and I don't know if I can. So I'm always struggling. There is me, Evie, the personality who has gone through the socialization and the crap of life, you know, and the trauma and the family situations and all of that. That's my personality. There's Evie, the soul, with lifetimes of incarnations, which is what I believe, and that's my purest part, my Izzy, my inner self, my wholeness. And the whole idea is integrating the two. And I found it a struggle my entire life to integrate, to become that wholeness, that compassion itself. I mean, in the early days when I got into nursing, all I could do was fight everybody in battle because everything I saw was wrong in healthcare, everything. And then when I studied with Buddhist monks and I started to get a glimpse of who we were on this soul journey. And then, of course, I found therapeutic touch, and everything became more tangible, easier to integrate the two parts of me into, so I could be more compassionate and to be a genuine caring self. And I've always struggled with why all of us in this room and many who aren't here today we've taught thousands and thousands and thousands of people, and yet there's only a small number of people who have sustained this. And why is that? Why is it? Is because they can't integrate, they can't live their soul purpose, they can't see it as a life pathway. I don't even know if I'm making sense at this point. I'm rambling. But I mean, I think I'm done. Thoughts?
Okay. So this is my answer. They're chicken. Dee said, this work is not for sissies. This is arduous. You know, is there anyone here who's not had a trauma? Not had someone die whom they love? Not had some really horrible, terrible thing happen? Maybe even 5 in 1 year. It is hard work. It is hard work, which is why in previous centuries, those folks who did this work were considered, in one definition, quoting, outstanding, extraordinary people. Because the average Joe, well, some of it is the average Joe is still trying to put food on their kid's table, right? Or breathe free air, clean air. So it does require that in the task that people have either the motivation, the gumption, the whatever, to keep to the hard work, to keep to the hard work. That's what I believe. Somebody's telling me to talk over here.
I was just wondering, when you're talking about there's no compassion fatigue, whether one of the reasons probably maybe for that is because you gave this wonderful description of what happens, and with the idea that when you're rooted in the heart, there's peace, but there's also non-attachment, and it's that non-attachment that sort of helps to move away from the the over-involvement or what results in fatigue in that way.
And we're connecting to that pan-dimensional universal force. That's an energy source. Plugging our little batteries in. Diana.
So I just want to thank you for your presentation, because it's really enlightening for me and helpful. And one thing that occurs to me is that we can use our compassion, we can use it right now to help the status of the world that we're in now. It's like Maureen, when she said she could step out of I can't remember exactly what she said, but the point is that we can step out of the suffering and tap into the compassion, and that the compassion can be used individually, but I believe it can be used for a worldwide as well. What I find myself is I listen to the news. I listen to it almost every day, but I don't feel like I'm completely, I don't feel hooked by it necessarily. And I don't feel like that is a bad thing. I feel like it's a positive thing. So I'm just wondering, it makes sense to me that this is one way to explain that I can step out of it and yet hold compassion for healing for the world. And the other question, the other thought I have is about, did you say compassion, sadness? Did you say
No,
words, or did they just pop into my head?
I did not say compassion, sadness, that I don't think I strung those two words together.
Okay, all right. I get the fact that we don't have compassion fatigue, but for some reason that popped into my little mind. So anyway, thank you.
Thank you, Diane. And you're doing a true service to watch the news, stay centered, and remain in that compassion. It's changing the thought forms. It's wonderful. Thank you for doing that. Yeah.
Oh, it doesn't make a lot of difference. Uh, what can I say? Well, two things. I had a discussion with my husband about this, about compassion and how it operates in healthcare. And one of the things that stands out is how do you cope when you see suffering? And the shutdown phenomena that happens, I would suggest that that's very typical. And I experienced it myself when I was working in the hospital. I'd have friends that I saw regularly, but you could tell that they were busy and there was no eye contact. There was no outreach. There was no connection, because whatever was here on their brain, on their mind, in their heart was more important at the time. And so Paul was validating the fact that, there's a point where you have to do this part of the job, but you don't have to go any farther with it. And I experienced that with nurses that get crusty, that don't cultivate compassion. And I do remember Dora saying that very often nurses are drawn to compassionate care because of that innate capacity for compassion. But I will say from my own experience, and I'm sure that everyone in this room would validate that with me, is that we have cultivated that capacity rather than being paralyzingly empathetic by feeling everything that's happening around us. There's a way to respond with presence that happens out of compassion, and we don't get drowned in our emotional reactions unless we're laughing really hard. And then we sometimes pee our pants. But I'm just saying that is a cultivated thing. And then I just want to respond to Denise. I've had years and years of working with people taking psychotropic medications, and centering and helping them feel, sometimes actually going through the whole ritual of therapeutic touch instead of just being in that presence with them. And it can be from somebody that's severely psychotic to severely depressed. They respond profoundly to the treatment and can become calmer. It may not lead to insight in that particular moment, but they're very responsive to therapeutic touch. however you practice it. So it doesn't seem to impact, escalate or de-escalate the effect of the drugs. I don't really know what's going on with those drugs when they're taking them anyway. So, but when I've had patients that I've worked with for long periods of time, they're very responsive to therapeutic touch, and just FYI.
Thank you, Susie. And just as a comment back, looking at, for those folks in healthcare who shut down and they're doing the tasks, a lot of reasons that that can be happening, obviously, right? From a Newman's Health is Expanding Consciousness perspective, is there's a phase where you're really just staying within what you know and what you were taught and da 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 da. And one of the things that we have not been taught, at least my generation, maybe some younger folks, but generally folks ahead of me, with me, and one generation behind, we were taught, I was taught, to act on my own behalf was selfish, not self-care. And so there are many folks out in the, helping professions who that's in the back of their head. That's what they were taught. So to take 5 minutes for a break, I mean, there are many nurses who do not pee for 10 hours because they're working. Okay, UTIs are high in nurses, urinary tract infections. So now the generation is being taught self-care is okay, but everybody hasn't gotten that message yet. So just as a, rejoinder, but I believe I have Jody waiting. Oh, sorry.
Jody first.
Sorry, Vicki.
Oh, okay. Thank you so much. This is just really wonderful. It's just, it's stimulating these connections in me, and the compassion. I just remember when I first met Dora and she talked about compassion, that it wasn't feeling sorry for someone. And I thought, I have no idea what compassion is. But then, doing TT, we have that innate compassion because we actually care about others' well-beings, right? And so maybe we don't have a definition, but we have it. And then I always remember Kathy Fanslow. I always loved how she would talk about the big C compassion, because that changed compassion for me from something that came from within me to like a universal energy. And that through our centering and the heart connection, so key, we connect with that. It's almost an effortless, it's that field expansion that connects with that, right? And so it has grown my ability to be present in compassion. And that, so that you can stand, like Diane said, you can be present with the news and be in compassion so that it's in the whole circle, not outside of the circle. So the problems aren't outside of the circle, they're in the whole circle, right? Because to me, that's the only way solutions can come. But all of this also is hooking up to yesterday, to something that Marianne Hanley said about what we're wanting to explore next that Dee hadn't gotten to yet. And it was something, I think, and Marianne, please help me, about the epiphanal knowing, but something going beyond. And then with Deb's meditation of going to the center within the center, somehow during that connected me to the universe, and it was compassion. The compassion energy was part of the connection for that. So there's something linking up that I want to explore. And I think as we do TT, we will explore.
Jody, got it.
Okay.
Got it. Keep going with that. That's one.
Okay. Thanks.
Thank you very much, Catherine. To answer Evie, to acknowledge it is hard, and even to continue on Jody's comments. In my mind, the hard work and why people don't continue with it is that they haven't found the pathway to go beyond themselves. We grow up and you know that there's some people that may have been born wise and they seem to have this unusual maturity about them at a very young age. And then others that no matter how old they are on the calendar, they are still children and they still very reactive. And, you know, they're afraid for themselves. So those people, those heroes that step in regardless for their own benefit, and that is what I would see those that are doing therapeutic touch in a very difficult situation, be it a psychiatric situation, somebody who's psychotic, whatever. If there's enough training, and that's where therapeutic touch is so good, because when we're centered, we're moving beyond our human. We're moving into higher realms that essentially are floating above the tornadoes and hurricanes and everything else underneath. And so if we could just encourage people to practice that, which is why Dora was saying, meditate, meditate, meditate. And Dee would echo that as well.
Thank you, Vicki. Mary Lou?
Thank you, Catherine. Thanks, everyone. I just wanted to comment that I love how you initially, way back at the beginning, talked about compassion as a process. You know, it's not and I really connect with that. It's not so much a state or an emotion, but it's a process that you engage with. And I like the action way of thinking about that. And I also love how Western science taps into ancient wisdom, and the 4 components of compassion, the cognitive, affective, intentional, and motivation, are the basic 4 Buddhist noble truths. The cognitive is the acknowledgement of suffering, that yes, there is suffering. The affective is the acknowledgement of the causes and conditions of suffering. The intentional is the belief that there is an end to suffering, and the motivational is the path to the end of suffering. And, you know, I just love to be able to connect these 2 pieces for myself and my own thinking and moving forward in the pathway of TT as that end to suffering somehow. Like, it's not like on a time clock, this is going to be the end, like who knows when that end is. So thank you for helping me put that together. I really appreciate it.
Oh, and thank you for the 4 noble truths. Didn't know that. Elke.
Thanks a lot, Catherine. I wanna tie in some words and ideas that were already spoken here. Exhausting, burnout, big themes in nursing, and you talked about self-care. I'm a nursing teacher and I teach the nursing teachers as well. So I'm involved in nursing education, and yes, self-care is a theme that increases, fortunately, but there are, I don't know anyone who is really knowing about the difference between empathy and compassion. So we are all lucky because we know TT and we are trained in compassion and we know how to train our compassion. But what about the other nurses? I think TT is the only intervention, the only nursing intervention that starts with self-care, some kind of self-care, to be centered. Centering is a self-care. It's the only nursing interventions. But this difference between empathy and compassion should be known by each nurse. And to train compassion should be known by each nurse. Each nurse should have the possibility to know the difference and to train compassion, to stay healthy and to do the work that they wanted to do. Because usually The young people wanted to become a nurse to help, to be helpful because of empathy, but they don't know the difference. So they have to know about compassion. And no matter what stuff I'm invited to teach, I try to teach them the difference between empathy and compassion, especially the nursing teachers.
Thank you for doing that. Appreciate it.
Thanks a lot.
And I think somewhere my email probably is out there. I'll give you, need some resources, just reach out.
Yes.
We have time for one more.
Discussion, all of this discussion is just wonderful. Thank you, Catherine, for generating it. Mine is kind of a technical question, I think. I'm fascinated by the functional MRI. Could that be used like for biofeedback? I mean, if you knew how compassionate or empathic, whatever it's measuring you are, could that help people develop it? I don't know. I would love your thoughts on that tool, the functional MRI, because I think it's being used in other areas of healthcare that I've read.
Really?
Yes.
The only way that I know that, just because of my work background, is that they're using it for, the neuroinvestigative studies. I mean, they use it for diagnoses and things, but
yes,
it's expensive.
I know. But I mean, it's a wonderful tool, a new tool that may.
Oh, yes.
More available, cheaper. I don't know.
It would be wonderful. Yes.
Is it not used widely enough yet because of the expense? Is that what it is?
That's my understanding, but I have a limited understanding.
I think it
about
has
that.
tremendous potential.
Of course it does. Of course it does.
It's amazing.
Wouldn't I love to get some experienced TT practitioners?
We can be
in
guinea
the
pigs. We'll be
fMRI.
guinea pigs.
Oh yeah. Oh yeah. But that's not where I'm at. In
Not
my
yet, not yet.
level of work. But
Thank
thank you very much.
Thank you.
And I think before we go to break, I need to introduce Kathy Arquette because we're going to do a little brain thing. Thank you all very much for your attention. It was wonderful.